Hi everyone, we're Team K Bandits.
I'm Tiffany.
I'm Justina.
I'm Diana.
And I'm Kiana.
So our project focused on exploring which characteristics among students, healthcare professionals, and veterans determine the use of benzodiazepines, also known as BZDs, in a sample of participants in the United States during 2018. BZDs are a type of drug that produces sedation and lowers anxiety levels, and some common names of BZDs that you may know are Valium and Xanax. According to the National Institute on Drug Abuse, 16% of overdose deaths involving opioids also involved BZDs. And between 1996 and 2013, the number of adults who filled a BZD prescription increased by 67% to over 13.5 million. This fact is alarming since BZDs are, unfortunately, frequently abused by being taken with alcohol and/or other drugs. So the increase in filled BZD prescriptions raises a flag as it can potentially lead to an increased rate of drug abuse. For this reason, our project is important in terms of bringing insight on the risk factors of BZD use among the sample participants.
For data preparation, we conducted feature engineering by first creating a new response variable that categorized BZD use into no use, medical use, and non-medical use. We also created two new predictor variables that classified whether or not the participant has used drugs other than BZD, both medically and non-medically in their lifetime, respectively. Then we separated the data into 3 data sets according to occupation. After that, for each occupation, we implemented random forest models and used the variable importance outputs to select variables with mean decreases in accuracy above the 3rd quartile, where higher decreases indicate higher importance.
During our model selection process, we used both a validation set approach and tenfold cross-validation to evaluate models using random forests, bagging, multinomial logistic regression, and support vector machines. After comparing our models, we selected multinomial logistic regression as the final model since it performed well and produced results that were interpretable. As you can see from the table below, our final models show cross-validation accuracies from 68 to 80% and validation set accuracies from 70 to 80% for the 3 occupations. So we're able to predict BZD use with high accuracy for all 3 occupations.
To better understand what specific categories contributed most to BZD use in each occupation in our sample, we categorized the predictors into 4 categories. Those related to mental health, history of prescriptions for opioids for pain, history of drug use, and demographics. The numbers represent mean % decrease in accuracy for each category. From the plot, we can see that, in our sample, students' BZD use was influenced strongly by the drug and pain categories, while veterans were influenced most by the mental health and pain categories, and health professionals had a similar influence across all categories. This is consistent with the variable importance plots we generated for the 30 most important variables for each occupation. Looking at the most important predictors for BZD use in our sample, we see that for students, the most important predictor was if they had a history of using other drugs. For health professionals and veterans, the 2 most important predictors were whether they had a history of anxiety or mental illness.
Keeping the variable importance plots in mind, we wanted to take a closer look at how exactly the most important predictors influence BZD use in each occupation in our sample. For multi-drug use, there is a significant influence on BZD use for all occupations. Almost 100% of participants who have used BZD, both medically and non-medically, have also used other drugs in their lifetime. We also see the highest proportion of non-medical use of BZD given a history of drug use for students. Taking a closer look at participants who have used other drugs non-medically besides BZD in their lifetime, we see that they are far more likely to also misuse BZD. For mental health histories, participants with mental health histories have higher instances of using BZD. For chronic pain, veterans have the largest proportion of BZD use given a history of prescriptions of opioids for chronic pain, followed by health professionals. And lastly, age is significant for veterans, with more younger participants having a history of non-medical use of BZDs. Health professionals also show a similar pattern, but not as distinct. Overall, our findings indicate that in our sample, having a history of drug use, mental illness, and prescriptions for opioids for treating pain are important in predicting the use of BZD for all 3 occupations. But the largest impacts for each occupation were a history of drug use for students, mental illness and opioid prescriptions for pain for veterans, and there were similar influences for each category for health professionals. It is important to note that our data was not a representative sample of all US residents in 2018, so we cannot generalize our results to the larger population. However, our findings could still demonstrate the importance of investigating the unique differences in determining BZD use for each occupation, which would lead into interventions such as targeted programs to reduce BZD misuse in each occupation. Hopefully, with these insights, we can make a positive impact on the lives of those affected by the misuse of BZDs in the United States. Thank you for listening.